Most male patients prefer to shave themselves, but for those who can't, offering a daily shave is a welcome hygiene measure. Perform hand hygiene and give the patient some privacy. Verify his identity using 2 identifiers.
Good morning, Mr. Gallagher.
Good morning.
How are you?
Fine, thank you.
My name's Jillian. I'll be the nurse taking care of you today.
Thank you.
Can I see your arm bracelet and you can tell me your full name and date of birth?
Peter Gallagher, August 11th, 1938.
Before shaving your patient with a disposable razor, review his medical history and lab values to assess his bleeding risk.
Do you take any medications that would cause your blood to be thin?
No.
Okay. All right. Let me take a look here at your face.
Look at his facial hair and skin to see if you notice any broken skin or reddened areas.
Go ahead and get the bed higher. I'll put the head of your bed up. You doing okay? All right. Okay.
Put on a pair of clean gloves and test the water to be sure it's not too hot.
Water feels good.
Place a washcloth in the basin and place a towel over his chest and shoulders. Wring out the washcloth thoroughly and place it over his facial hair for several seconds.
Okay.
Use soap or shaving cream, depending on the patient's preference. Apply a layer of shaving cream about 1/4 of an inch thick.
Can you look up for me?
Be sure to smooth the cream evenly over the sides of his face, over his chin, and under his nose. Hold the razor in your dominant hand at a 45-degree angle to the skin. Then, with your non-dominant hand, gently pull the skin taut as you work. Begin by shaving across one side of the face, using long, firm strokes in the direction in which the hair grows. Use short strokes around the chin and lips. Check with the patient to make sure he's comfortable so far.
Doing okay?
Fine.
As shaving cream accumulates on the razor, dip the blade into the water basin to rinse it.
Can I go ahead and take your glasses, Mr. Green, so I can shave you?
Yes.
Okay.
If you're using an electric razor, begin by putting on clean gloves if necessary. Drape a bath towel over the patient's chest and shoulders. If the patient wishes, apply a skin conditioner or pre-shave lotion to his face.
Would you like the lotion for your face before I shave you?
No, thank you.
No? Okay.
Turn on the razor and begin shaving across the side of his face. Pull his skin taut and use a gentle downward stroke in the direction of the hair growth.
Can you tuck in your top lip? Okay, Mr. Green, how does that feel?
It was wonderful, thank you.
Okay. Can I put a little bit of aftershave on your face?
Yes.
When you're finished, pat on a little aftershave if the patient wants it and it's not contraindicated.
Okay, Mr. Gallagher, I'm all finished.
Great job, thank you.
Thank you. I'm gonna come back with some warm water, okay? And get your face all cleaned up.
Okay.
All right?
When you finish, dispose of the razor in the sharps container. Then change the water in the basin. Apply clean gloves and rinse the patient's face thoroughly with another warm, moist washcloth. Dry the patient's face.
Dry. Okay.
And discard the towel and washcloth in the linen bag. Offer the patient some aftershave.
Would you like any aftershave, Mr.
No,
Gallagher?
no thanks.
No aftershave? Okay.
Help him get comfortable and return used equipment to its proper place.
Okay. I'm just gonna put these things away and I'll be back to get your personal items for your bedside table.
Great job, thank you.
Okay, thank you.
Remove your gloves and perform hand hygiene. A patient with a mustache or beard might need special care. First, drape a bath towel over his chest and shoulders. If necessary, gently comb the mustache or beard. Before you begin trimming, hand the patient a mirror so that he can point out which areas of his beard or mustache he'd like you to shape up. Hold a pair of small scissors in your dominant hand as you groom those areas.
How's that?
That's great.
As part of your follow-up care, inspect the condition of the patient's shaved face. Be sure to check the skin beneath the beard or mustache. Ask the patient if his face feels clean and if he's comfortable. Record the shaving procedure. If there are no specific areas indicated, make a note in the medical record. Note how the patient tolerated the procedure and if there were any complications, such as bleeding, pain, or problem skin areas.